Hello, and welcome to the Will County Community Mental Health Board podcast. My name is Tina Mackey, and I'm the Executive Director. Mental Health Board opportunities were established in 1963 with legislation signed by President John Kennedy. In Illinois, House Bill 708 allowed for the creation of mental health boards, which is why we often refer to them as 708 boards. Fast forward here in Will County in the fall of 2022, residents of Will County voted yes to a tax levy referendum establishing the Will County Community Mental Health Board in order to provide services locally for individuals living with mental illness, substance use disorders, and intellectual developmental disabilities. The Will County Community Mental Health Board is eager to share with you information about our grantees. Welcome to our podcast. Hello, we're happy to have with us today Shawn Marconi, the Executive Director of the Will-Grundy Medical Clinic Health Partnership, often referred to as the Will-Grundy Medical Clinic. Thanks for being here today.
Thank you so much for having me.
Yeah, we'd like to talk a little bit about your operation. How long has the Will-Grundy Medical Clinic been in the Joliet area, serving the county?
Almost 40 years. We've
Oh,
been
okay.
here since 1988.
Okay. All right. So what is your role in the community? Let's talk a little bit about your role in the community, the impact that the Will-Grundy Medical Clinic has on Will and Grundy counties.
Absolutely. Thank you so much. So, as stated, we've been here since 1988. We are a Will-Grundy Medical Clinic. However, we've been doing some rebranding because we've diversified the services that we're providing. So, we are WGMC Health Partnership.
Okay.
And the impact that we've had on the community include big picture, over 200,000 free healthcare visits, over $200 million in healthcare services,
Wow. Okay.
all free of charge provided to the community. We also had a big impact on the community during the pandemic. We were at one time providing more vaccinations, doing our mass vaccination clinics than the other healthcare clinics in the community.
Okay.
So we provided everything from healthcare services in our beginning to diversifying to provide dental services, housing, social services, therapy, behavioral health services. We have a full-scale dispensary. So it's not a pharmacy, it's a dispensary because we provide the medications all free of charge. It's very important to not only provide that healthcare visit, but then to also provide the medication. It's important in order to provide comprehensive health care.
Okay. And I think we're learning more about this concept of integrated care and super important wraparound services.
Yes.
So we're not just talking about a physical malady. I think we're beginning to understand more that physical, dental, really important.
Yes.
Behavioral health screenings, housing, and again, some of those what I call wraparound services. They all affect each other, right?
Yes.
If someone has a substance use disorder, we've got to recognize some of those needs in order to be able to serve that individual well.
Absolutely. So it's important in order to provide holistic health care to address what's called the social determinants of health. And these include things like housing, transportation, nutrition, education, the built environment. Those are your social determinants of health. It's often seen that individuals can have access to care, but the social determinants of health provide barriers barriers to access. So if a person doesn't have transportation for their medical visit, that is an impediment, and they are unable to get that comprehensive care that they need. So at WGMC Health Partnership, also known as Will-Grundy Medical Clinic, we not only provide health care, but we address the social determinants of health.
Okay.
So we have a housing program where we do what's called tenant-based rental assistance, where we support individuals and families who have chronic health conditions or they're in recovery from a health condition. We provide rental support as well as case management and social services support so that we can transition that individual or that family to independence and self-sufficiency while simultaneously addressing the healthcare and the social determinants of health. We also have a pretty robust behavioral health program where we're providing therapy, counseling, individual therapy, and group therapy, again, addressing those social determinants of health. But it's not good enough to just provide the services. We must also impact the environment. We must also work on an advocacy and a policy level
Okay,
so
sure.
that we change the healthcare landscape, so that we ultimately have a society where a WGMC health partnership is obsolete because everyone has access to
Right.
care.
Well, and not to get too far astray, but prevention and early intervention,
Yes,
super important
yes,
elements to that concept of integrated care. And I think it's important that you mention, individuals and families.
yes.
Sometimes if a family is struggling with housing or food insecurity or safety in the community, it's hard to make a commitment to those prevention opportunities, right? To see your healthcare professional regularly, to see the dentist regularly, when a lot of your energy is going into these other circumstances to try and help take care of your family.
Absolutely. So when individuals don't have access to health care, number one, they're not able to address illnesses in the early stages. And so when they finally do address them, it's often they're far
Yeah,
along and it's a disaster.
yeah.
And
And other things have begun to pile up as well.
absolutely. And their care is more costly. So, if an individual is able to address that illness in the early stages with prevention, just diet and exercise, then most likely some illnesses will not even develop. So, it's important that people, number one, have to have access. Number two, they have to have the information, the knowledge, what services are available so that they can attend to their healthcare on a regular basis
Sure.
and so that they're able to prevent the onset of many diseases. So
Okay.
it's a system, it's supportive services, it's the education piece, all working together. But at the center of that is access to healthcare.
Okay. Let's talk a little bit more about the folks that you serve, that the people that are walking through the door. I think there's an impression in the community maybe that Will-Grundy Medical Clinic serves homeless folks and or uninsured folks, and I'm not so sure that covers the scope of the people
No.
that are provided services. Um, some of those folks do take advantage of your services, but there's other people who find themselves in a situation where maybe they're between insurance. You've got a I've heard you tell the story about a fella who was going from one job to the next and had I think he was diabetic and needed
Mhm.
medication, big family. Maybe we could talk a little bit about that kind of a situation.
Yes, and so diabetes, unfortunately, it's on the rise in the U.S. And it's a pretty devastating diagnosis, but it's very treatable. And you have to be very assertive with that treatment. So this gentleman was father of five, married, and his wife stayed at home, and he changed jobs, got a new opportunity, but he had a 90-day wait for his insurance to kick in. And he could have cobra'd his health care, his health insurance, but that was incredibly expensive. Or he could have paid out of pocket for his insulin. And at
No,
that
and no one
point,
can afford that.
no one can afford it.
Yeah.
It's either you pay your mortgage or you live.
Right.
And that is the situation that many people are in. In fact, 70% of our patients work. They have jobs. But these are individuals, because of various circumstances, they don't have access to care. And like this gentleman, they may be in a gap period, and so they stop on down to the clinic, and we don't turn them away, and we provide those services. Now that was a success story. But there are plenty of stories, and unfortunately, this young man he was in another state, did not know about the free clinic. I just read about this young man who aged off of his mother's insurance. He had a job, aged off of his mother's insurance, turned 26 and was no longer covered, was diabetic. And as he was in that gap period, and he had no access, and he didn't know of a free clinic, he started to ration his insulin.
Oh, gosh.
And was rationing the insulin, trying to hurry up and get on a plan. He went to sleep one day, went into a diabetic coma, and died. Like, that is how critical. Thriving young man in his 20s. Can you imagine, that we have people in their 20s,
Right.
that will die.
In all age groups.
All age groups that will die without access to health care. And it's not necessary.
And just because you're employed doesn't mean that you have benefits.
That's right.
Right.
That's right.
More and more jobs nowadays don't always come with the benefits, and so it's just so expensive to try and I have insurance, but even the copay
Yes.
can be very expensive, can be difficult for individuals, and especially if you're talking about families who maybe have more than one health issue going on at the same time.
Absolutely. So insulins for diabetics, that's $2,000 easily for your insulin monthly. And then there are other, like if you have respiratory issues, those medications for COPD, those are thousands of dollars.
Right.
So for the most part, when you're in a situation where you have to choose between your medicine or whether you have a place to live,
Right.
it is a no-win situation.
Sure.
And that's why we are here. That's why we're here to support the community.
Okay. And I think, we often overlook dental. Dental isn't always part of the conversation, but good dental care, especially for young people, as they're growing, is so important. And again, if you don't have benefits, or sometimes if you do, dental care isn't always provided. I know my mom has part of her regular budget. She makes sure she saves some every month for her 6-month dental visit. I don't know that she's ever had coverage for that.
Yeah.
And so, offering dental as well is really an important piece of the whole puzzle.
Absolutely. And that oral health is directly tied to cardiovascular disease, actually, and diabetes. How poorly or how well your oral health is often indicative of other healthcare issues.
Okay.
So it's important to have that dental component, and we're so grateful for the partnerships that we have, and the ability to provide those dental services, because again, it's part of that comprehensive package of healthcare services.
So we've got medical and dental, and then you said you've got a fairly robust behavioral health program. So again, when we talk about the integrated care, that's such an important element as well. Let's talk a little bit about those services.
Sure. So we have a program, our Housing, Healthcare, and Hope program, where we provide tenant-based rental assistance, where we support families who also have chronic illness or maybe behavioral health illnesses, services that they are in need of. And we provide rental assistance, but also the wraparound supportive services. So we help with workforce development. We help, of course, with behavioral health. We help with whatever chronic disease and medication and coordinating visits to their providers. Just that whole wraparound services for a year in order to help that household transition to stability. We also have a medical respite program.
Okay.
Now, medical respite is for individuals who are literally homeless, but they are being released from hospital. And so they can be recovering from cancer treatment or major surgery or heart surgery, and they are literally homeless. So we've had individuals who went into the hospital with housing, and when they are released, they've lost their
Oh,
housing.
golly.
And so they're homeless and they need a place,
Right.
number one, to
To
recover
recover.
and recoup, and also to prevent readmission. So we have a medical respite program, and that program does just that. It provides temporary housing, also nurse case management and
Okay.
supportive services, behavioral health services as well. It's 7 days a week of support. We check on the individuals every day. We also ensure that they have 3 meals a day,
Okay.
7 days a week. And we coordinate visits to social services or work with workforce development. We also have a housing transition plan. And the plan is to transition them to safe, stable, affordable housing.
Oh, nice. Okay.
Yes.
Okay. So, a key component, and you referred to this a little bit, a key component in wellness and recovery and sort of getting back towards stability, it often I think is medication management.
Mhm.
We don't always do exactly what we're supposed to do
Yes.
and follow our prescription exactly the way it's written, right?
Mhm.
So medication management, especially for somebody in recovery, is so
Yes.
important. And it sounds like maybe you offer that service as well.
Absolutely. So, though we cannot call ourselves a pharmacy, we are a dispensary, we do have licensed pharmacists who volunteer. We also work with Midwestern School of Pharmacy, and we
Okay.
have pharmacy students who do teaching.
Oh, nice.
So, not only are we providing the medication, but we're teaching patients about the importance
Okay.
of the medication. And our goal is to ensure that our patients have the support they need in order to make the best medical decisions for themselves.
Sure.
We want them to take ownership of their health care because you don't find your health in the doctor's office. It really and truly is in the community. It is
Right.
while you're at work, it's while you're at home, it's during your leisure time, it is taking your medication as prescribed, understanding your medication, engaging in stress lowering activities, managing your stress level so that it's all encompassing of your health. So, providing that medication piece and also providing that teaching piece
Okay.
with our licensed pharmacists and our pharmacy students, it really helps to drive home that point, the
The more
importance.
educated we are, the more likely
Absolutely.
we are to be engaged
Yes.
and take better care of ourselves.
Medication all free of charge. If we don't provide it in house, everything that we provide in house, free of charge. If we don't provide it in house, then we provide a script, and usually the copay is only $4.
Okay.
So we ensure that everyone gets their medication. We're able to get insulins, different insulins. We have some of the newer versions of the insulins. We even have access to the GLP-1 medications for our diabetics who have their diabetes is not well controlled, we're able to write to the pharmaceutical companies, and oftentimes they will provide that support for our patients and provide those medications free of
Oh,
charge.
nice. Okay, so you're located on Cass Street,
Yes.
right? Uh, if like how does it unfold? Do people just walk in? Do you need to have an appointment? Once you're established, can you just call for an appointment on a regular basis? How
Yes.
does it, like, the day-to-day housekeeping of it unfold?
So I'll tell you this. This is exciting. So we are making plans to have some walk-in hours.
Okay.
So that's coming soon. So in order to be a patient at the clinic, you can come in, you can call. There's a paperwork packet that you complete to just register, and then we schedule you an appointment.
Okay.
So it's pretty easy, pretty simple. We are also working on this. We have this new plan for pop-up clinics where we will be partnering with partners in the community, with other nonprofits, other organizations, where we will be doing pop-up clinics where we
Nice.
will have a nurse practitioner, and that nurse practitioner will screen for diabetes and hypertension
Great.
and high cholesterol.
Okay.
And we will help individuals if we determine that they are at risk or that they most likely have a chronic illness. We will either schedule them to come in and be a patient with Will-Grundy, or we will work to find them another provider in the community. So, and it does not matter, insured, uninsured. We just want to screen
Okay.
people.
That's nice. That's because I think you're a sort of a hidden gem to some extent. Folks that um, are in a position where they really need your services aren't always exposed to
Yes,
the media or uh, uh, organizations that can refer to you, that kind of thing. So, getting out of in the community a little bit more, engaging a person where they live, I
absolutely.
think will be really helpful. You have another program, the Equity Institute.
Mhm.
What's happening with that?
So at Will-Grundy, we know it is important to provide the services, so downstream services, but it is also and equally important for upstream advocacy. So our institute has engaged in programs to, number one, improve the healthcare landscape for all residents of Illinois. So we've done a lot of advocacy at the local, state, and even at the federal level. So that's some of the things that we do with our institute. We also like to determine what are the challenges in the community. So we do some research and we share our data. With the community. So it's important to understand what the community needs are. So there has to be a research piece for us in what we're doing. And as I stated, we are engaged in a high level of advocacy. Now, our Equity Institute, we actually partner with universities, and we have university interns who help us with our research, help us with program development, implementation, program management.
Okay.
So it's really important in order to ensure that the services that we are providing, that number one, they're making a difference and an impact, but number two, we need to understand the community needs, and our institute helps us with that. It's like our ear to the ground. So we are way ahead of what the community needs, and we're developing those solutions, and we're partnering with other organizations to implement and launch various solutions in the community. For example, out of our Equity Institute, we've got a full understanding of the breadth of the housing crisis in the nation, but specifically in
Okay.
Will County.
Okay.
There is a housing shortage. There are people, and in fact, often many nights there are hundreds of people in Will County who are sleeping outdoors. Many of them are chronically ill. Many, you'd be surprised, are actually employed. we encountered a young man who was in school and had a job, and he was living in a tent. So there is a housing
Yeah.
crisis,
Yeah.
and our Equity Institute helped us to understand the breadth of that housing crisis, but then to also develop solutions
Okay.
to that crisis.
The Equity Institute helped develop the needs assessment, the
Mhm.
behavioral health needs assessment for the Will County Community Mental Health Board
Yes,
last spring,
yes,
and turned that information around pretty quickly
yes.
for the 708 board. And I was so impressed. It wasn't just a situation where you sent out an email survey or distribute a survey. Some of those things were happening, but you went to providers. You went to the folks that provide Scylla housing. You
Mhm,
went to people that were unhoused
mhm,
and asked questions and gathered information that you wouldn't typically solicit from
mhm.
folks. So I was really impressed with the Equity Institute operation and the resulting survey packet. Cost, availability, and transportation, always the top three in terms of
Mhm.
barriers to education and services. But we also saw housing, food insecurity, and violence.
Yes,
People aren't feeling safe through many portions of the county, and so lots of good information.
yes,
It's hard to
yes.
tackle a problem if you don't know exactly what the problem is, right?
Absolutely.
Right.
It is critical to understand the community needs so that you can implement those solutions, and the community has to be involved. And the beauty of that project with the Institute, the Mental Health, Behavioral Health Needs Assessment, is that the community was so very involved. The people in need of the services, they drove that survey and the
Right.
results.
Right.
So it was excellent, and the ability to share that with partner organizations, and for partner organizations to use that data to secure funds to bring to the county so that we can meet the needs of the residents.
Right.
I mean, you just could not get much better than that.
That's a good point. That given the opportunity to provide feedback, people from all walks of life were eager to do that. We're eager to be
Yes,
engaged and give good feedback, so we
yes,
can evaluate what those needs are countywide.
absolutely.
So, one of the key components of the operation, you've mentioned it a couple times, are your volunteers.
Mhm.
So, let's talk a little bit about who are the folks that are providing these services?
So we have been so fortunate over the years. Will and Grundy County, wonderful counties, wonderful people, very giving people. So we're supported by partner hospitals, Morris Hospital in Grundy County, top notch. St. Joe's as well, top notch, always been there for us. And Silver Cross, I cannot say enough about Silver Cross. So physicians from those hospitals volunteer, nurses, nurse practitioners, they support us. We are a United Way agency, and we often get volunteers through United Way.
Okay.
So this is a people-powered mission. So we are now at around 25 staff, but I would put number our volunteers in the hundreds, and
Okay.
throughout the years, we have physicians who take our patients in their own private practice in their offices, and we also have physicians who come on site. We have nurse practitioners and nurses who come on site and provide care. So we're able to provide millions of dollars in free health care and services only because of the generosity of the people of Will and Grundy
Okay.
County.
Now, what if a person needs a specialty uh, physician or a specialty doctor? What are those options that you provide for that individual?
Absolutely. So, again, we look to our community, we look to specialists within the community. And again, we've been fortunate. We've been able to build those relationships and ensure that our patients get that comprehensive care and they get that specialty care free of charge.
Nice. Okay. Okay, so we've talked a little bit about initiatives and going forward. What about the wellness village?
Yes.
We want to talk about that a little bit.
So yes, that is a project that came out of our institute.
I'm really excited about the
Yes.
potential for this project.
Yes, I am as well. You know, when I think about the wellness village, I think about a lot of things, but I think about an individual, one of our clients who did not make it, was a veteran, served our country, and he had some challenges, some health challenges, and we were unable to get him into housing in time. We worked really hard, worked on getting him into housing and to some behavioral health services that needed, and he finally got to that point where he said yes. He was ready, and unfortunately, because of the resources that were available, it would have taken us 3 days. And so we were working the 3 days trying to line everything up and get everything situated so that he could move indoors and get some treatment. Now, again, this is a veteran, served our country, he fought for our freedom. So, but unfortunately, that third day, when we were able to line up the transportation,
Sure.
when we went to go find him because he had been living in a tent under a Cass Street Bridge, he was dead.
Oh gosh.
He passed away, and the staff, we were all devastated, devastated. And so every time I think of the wellness village, I think about that veteran who was sick. He was struggling. He had some behavioral health and some medical conditions. But I think about him, and had there been a wellness village, he will be here today.
Sure.
And so that's what the Wellness Village will do. It is a permanent supportive housing complex. It will be built with all of the green energy standards. We will have a walking path, a community garden. We'll do farmers markets in the summertime. In the Wellness Village, we'll have a medical center. We'll also have a workforce office. We'll have counseling and therapy, case management, and all the supportive services that are necessary. But most importantly, we will have housing. And this housing, and specifically permanent supportive housing, is for disabled veterans. It's for individuals and families who have a family member who has a disability.
Sure.
It's for people who are at risk of homelessness or who have been chronically homeless. You'd be surprised that individuals who find themselves in situations where they are facing the loss of housing or they have already lost their housing. So it's important to have this type of housing available. And the beauty of the Wellness Village is it will be in walking distance to Aunt Martha's healthcare center. It will be also very close to a lot of the veterans programs that are under construction underway at this time. It'll be located very close to transportation, very close to entertainment. It will be in a wonderful location in the community. And again, it's for families, individuals who have a chronic health condition, who need permanent supportive housing services. And again, I think about the veteran, the client of ours who, had we had a wellness village, he would be here with us today.
Right. Right. And I think we can all think of folks that are in that circumstance. The message of you are not alone is so important, that people have, again, that 360-degree level of integrated care. And let me ask you this question, because I like the message. I like your answer to this question. I've heard you give this message. Why is this important in our community?
So the wellness village is important in our community because everyone needs access to housing, healthcare. But it's not just for those individuals who have the housing or who have access to the healthcare. It's for the entire community. When everyone has access to healthcare and everyone is healthy and housed, your community thrives.
Right.
When people have access to housing and healthcare, they pay bills, they go into the shops, they go to entertainment venues, they contribute to the vibrancy of the community. Healthcare is about economics. The healthier we are, the better engaged we are in
Right.
supporting our community, and the more our community thrives. So if you have a community where individuals don't have access to health care and they're utilizing, say, the emergency room,
Right.
then the overall cost of health care, because emergency room care is incredibly expensive,
The most expensive
the
way
most
to way to
expensive.
engage in services, right?
Absolutely. That's going to drive up the cost for everyone. So even if you have insurance, those costs for the uninsured, they will be absorbed, and absorbed by every last one of us. So it is better for families, individuals, to have access to healthcare, access to housing, access to workforce services. You will have a thriving, vibrant community where everyone belongs.
Right.
Everyone gets the support and
Right.
services. We don't have to move anyone to the side. Nobody's an other. We are all included. We all belong, and we all get the support and services that we need. And then our community will thrive.
So prevention, early intervention,
Yes.
the integrated care with wellness communities. That's all we need to put you folks out of business.
Yes.
Right.
Put me out of business.
Right.
Yeah, I would like, actually would love to just do art, write books,
Yeah.
give speeches. That's what I want to do. So yes, put us out of business.
Okay. So we've got wonderful service opportunities, and again, those wraparound services, physical, dental, or medical rather, dental, and behavioral health.
Yes.
So important, that integrated care concept. And then for folks who need ongoing services or additional, there's a warm handoff
Mm-hmm.
to other providers in the
Yes.
community for those folks.
Mm-hmm.
We've got a great volunteer corps. We can always use more volunteers.
Always need more volunteer.
Right?
Come down to the clinic.
So I think the last element is fundraising.
Yes.
And how your funding works. You have some fundraising opportunities for folks in the community to get involved, I think.
Absolutely. So we have events, of course. We also do campaigns. We have a mailer campaign as well. We are supported by grants and individual donations and foundations, our hospital partners as well. But come out to our events, or just come and visit the clinic, and come see for yourself. See for yourself the really good work that's being done by our volunteers, and maybe you might decide to volunteer. If you want to give a donation, you could go right to our website, and there's a big button that says donation.
So what's your website?
Will-Grundy-medicalclinic.org.
Okay. All right. And really all the information that we've talked about today, it's a very comprehensive, easy to navigate website. I find a lot of information there, and I don't do well with technology. So I encourage people to go there. Any last thoughts?
Well, I'm just thinking about that prevention piece.
Okay.
And so I want everyone, I'm a challenge for you. If you don't know your A1C, your blood pressure, your lipid count, your BMI, and your family history, I'm challenging you to go get that information. Know it. Talk to your doctor about it. Next time you go see your doctor, say, hey, doc, what's my A1C? The A1C is the 90-day average of circulating sugar in your blood, to put it quite simply, sugar in your blood. And the reason why that's important is because high blood sugar, the sugar crystal is just like we learned it in chemistry. It's sharp. It's like a crystal, like an icicle, and it can cause severe damage to your blood vessels. And so those highly vascular organs, those kidneys, those eyes, feet, hands, they are all damaged when you have lots of sugar in your blood. So talk to your doctor about that. Get some exercise if it's up. Follow your doctor's treatment, what your doctor recommends. But most importantly, know your sugar, know your blood pressure. Actually, this is a good reminder. I have to share this with my board and my team members. Was listening to a podcast, and they were discussing how earlier intervention with blood pressure. So historically, blood pressure is treated when it's over 140, over 80, but now they're saying when that top number gets to the 130s, they want to start treating it. Treating it earlier results in better outcomes.
Okay.
So what's your blood pressure? I'm challenging you. You know your blood pressure? Know that number. Also, lipids. What's the fat in your blood? Your cholesterol. Know those, and those are multiple numbers. Know those numbers like the back of your hand. Like carry it in like a little card in your wallet, because it's critical to living a long, vibrant, full, healthy life, critical for your ability to contribute to the community and take care of your family and enjoy your life. So know that cholesterol, know that lipids, know those numbers. Also, know your family history.
Sure.
What happened? Who is
Super
cancer
important.
on one side or this side? Is there a history of heart disease? Is there a history of kidney disease? That's important. And because it will guide your provider, guide your doctor in making decisions on what tests you need to test for early and what needs to be watched. So know your family history. And then last but not least, know your BMI. That's a number. I don't like to know the BMI. I don't want to hear about it.
I don't want to look at that number too often.
I don't want to hear about it. But it's linked. It is linked to cardiovascular illness. It's linked to cancer. So the higher that number is, unfortunately, that's a number you don't want to score high. You want to score lower on the BMI. So, but know those numbers. Have the conversation. Have a conversation with your medical provider, and have a conversation with your family members. And you know what? Make it a subject of dinner talk. Talk about those numbers
and get educated about how to manage those numbers.
That's right.
Eating right, getting good sleep, getting a little bit of exercise every day. But I'm glad you mentioned this. Let's take that concept a couple steps further. So when we're not feeling well medically, we know we've got to get some rest, or maybe take an aspirin, maybe see our doctor if there's something that maybe is ongoing or chronic. We could take a prescription. If our tooth hurts, we go immediately. We get in to see our dentist. Spiritually, if we're not feeling well, we might make sure we get to church or talk to our pastor or priest. Read the Bible. We kind of have an idea of what to do to remedy some of those things, and usually we don't hesitate to take part or get some advice or get help. But for some reason with our mental health, we still find ourselves in that situation where stigma is so pervasive in our communities that we often don't reach out. We don't seek the help that we need.
Yes.
And so I like your concept. I too would challenge individuals and families to embrace those challenges and get the help you need. Reach out to the counselor at school or a social worker at school for your children or families, or or make an appointment to see a counselor.
For sure.
Find information on the internet to read and just get educated. NAMI Will-Grundy is a fantastic provider in our community for folks who are facing some challenges with peer support. The living room is 365 days a year, no cost. All you have to do is walk in and talk to somebody. So again, medical, dental, spiritual, mental health.
Mhm.
Take action,
Yes,
take action, work on prevention and early intervention, and that's where it's at, I think. And
absolutely.
come to the medical clinic and
Come
get
to the
the
medical
help that you
clinic.
need.
Absolutely. We have a pretty robust therapy services, individual and group therapy.
You have
We-
You Are Not Alone program, I
Yes,
think.
yes,
That's what,
yes,
one Friday a month,
yes.
and psychoeducation screenings are
Yes, we
available.
do health screenings also. It's on the spot therapy. So you can meet with one of our therapists, go into our counseling room, and have someone to talk to, talk about your mental health challenges. And that's where it starts.
Right,
That's
right.
where it starts.
Get
So,
educated, get help,
yes,
and take care of yourself
take
and your
care of yourself.
families.
Yes,
Be a good family member to encourage and be supportive. Be a good friend. Be a good
that's right.
friend to your neighbor and your
Yes,
coworker and your church member, and
yes,
make clear that I'm willing to be. I'm willing. I'll go with you. Let's
yes,
go talk to somebody.
absolutely.
So that's how we build healthier
Mhm.
communities. So.
That's it.
Okay, so thank you so much.
Thank
I
you.
can't wait to hear more about the wellness program.
Yes.
We'll have you come back, and
Oh, for sure.
we'll talk more about that in the future.
Ribbon
And
cutting.
yeah, yes. And thanks for being with us.
Thank you.